Hi, Tony Scelzo here. Welcome to Zipline. I get to work with some of the best technology companies really out there today, and today I've got our sister company, SmartIT Solutions. I've got Andre Hurd, who's the Director of Healthcare Solutions, and there is just a transformational movement happening in Indianapolis, Indiana, in the healthcare information space. Now, Andre, what are you doing over there at SmartIT? What is your background? How did you get in this hot mess that you're in right now?
Sure. Well, so I've been in healthcare IT for a little over 15 years. Worked in the acute care markets, mostly project management, things like that.
Okay.
But I've also done a lot of other more technology and infrastructure related work. But as the years have gone on, I've become a little bit more operational. In fact, quite a bit more operational, just in viewing, how healthcare is leveraging clinical operations and architecting it around technology and finance infrastructures. And so one of the things that we believe we're bringing to the table here is an opportunity to take what is happening in the outside the healthcare market in the consumer space,
right.
use that same technology, those same business operation improvement methodologies, and combine those to actually assist the continuum of care in this healthcare market that's just so rapidly changing right now.
And your background really is on the provider side, and so you're bringing all that knowledge base of understanding what makes that thing tick, and now looking at how do we partner as a technology organization with the provider in order to handle some big, very pressing issues that's going to smack them dead in the face. I mean, this accountable care movement has not been an easy ride for anybody. And the providers are really, that everybody's talking about the carrot and stick, right? Well, they're about to get hit with the stick and lose the carrot. Is that fair?
Absolutely. So in part of the big paradigm shift here in this ecosystem is the movement from fee for services to fee for outcomes.
Right.
And so, all the stimulus dollars are going to these large healthcare systems in eligible providers and facilities.
Right.
And they're using some of those funds to transform their IT infrastructures. It's the boom of the health IT space, especially here locally in the Indianapolis area.
Right.
But that same model is going to have a different and longer lasting impact on the post-acute care market, long-term care facilities, skilled nursing facilities, rehab, nursing homes, things like that.
And that really is the space that you've started to even carve out for SmartIT is like, everybody's going after these big providers, but what's really getting forgotten is the long-term healthcare space. And you think there's a way to leverage technology using your methodology to really help them be more accountable in this movement. Is that fair?
It is. So we want to take the same KPIs that are associated with clinical outcomes, rehospitalization rates, patient satisfaction scores, length of stay,
right.
AR days, things like that. But we also want to bring to the table some operational data points, some other types of things that are going on in the market space. For example, fiscal year budget 13 to 14 went up $14 million in congregate nutrition services. Well, those are data points that should also be architected around some of your clinical KPIs
right.
to not only to provide better outcomes, but also in a way that you can expose the friction in your operational processes, which is exactly why you're seeing big healthcare systems right now do one of two things, or maybe both. They're cutting lots of staff, and
right.
they're figuring out how to operate more lean,
right.
and they're consolidating.
Right.
Bigger healthcare systems are buying up smaller ones.
Okay, so Andre, one of the things that we've developed and kind of went back and forth with your marketing plan, this long-term healthcare space. Now, what are the pains that you see that they're suffering from in understanding how to embrace the technology movement, let alone the process failure that's going on in the organization? What are the real, big sticks that they're facing that they're scared of right now?
So transitions of care, how they're going to participate in the continuum of care without the same level of support and funding that those other eligible facilities are.
Right.
How are these folks going to remain competitive in a marketplace with a consolidating acute care system?
Right.
How are they going to engage their population? How are they going to make sure that their services are going to continue to remain competitive to meet the increasing demand? The National Council on Aging actually put a statement out the other day that 10,000 people will sign up for Medicare every day for the next 10 years.
Wow.
That is an overwhelming statistic, and some of these folks who are within these organizations haven't had the business operation attention combined with the technology infrastructure architected around their clinical operations to develop a strategy that is sustaining, not only to provide their portion of those clinical outcomes in that continuum of care, but also to make sure that their business operations are running lean and smooth and flexible enough to meet those demands.
And Andre, I think what's so different about the way you guys are going about this, the way you're approaching this, is you understand that their cheese is fundamentally moving, and you're going ahead of where you think they are, showing them the direction and vision that they need to take to accomplish these goals by sitting so far in their seat, because that was your role. That's what you did before. You actually did their job. And to the success that you had in the past, showing them how to achieve that success, now that you've been on the technical side, you're able to combine that into a very unique solution. Is that fair?
I believe so. That's what we believe we're bringing to the table here. So, when you're managing these large-scale programs of these EMR systems that get implemented into these health systems, the very first thing that one observes once the go-live is complete, so to speak, is that operational processes are broken everywhere.
Right.
And oftentimes those get associated with technology issues when in fact, because of the nature of these holistic EMR systems, moving away from siloed applications, that is, you now expose business process issues that need to be addressed. So that is part of the rapid shift in this ecosystem in the large healthcare systems. Well, the fact of the matter is, while I've been successful in implementing those systems, we learn a lot making mistakes too.
Right.
And from those, we can absolutely see an opportunity with some of these folks out here in this marketplace to take advantage of what we're bringing to the table in terms of our knowledge and experience and how we can apply that to help folks grow.
Now, Andrew, I want you to spend just a little bit of time. Now, I know your background and your resume in the healthcare space, and I know about what SmartIT has brought, but talk to me a little bit about what SmartIT's been able to do and combining their success dealing in the enterprise space and bringing that into the long care provider space. What is that combination doing for the consumer for your product? What do you see that solution being, and why is it an advantage over your competition?
Sure. So SmartIT originated as a staffing company in 2005. And SmartIT Solutions actually is an arm of that, where we deliver a lot more in the professional services area, consulting, integration services, big data solutions. However, we believe that we can combine our success with staffing and finding very, very, very quality resources, especially here locally in the community, combined with what we're bringing to the table in terms of knowledge and expertise, and apply that to a space where we believe there's a growing need that we can meet and create some good partners and long-lasting success.
So it's really a blended solution, really, when you think about it. I mean, they're getting your expertise from the PM and the process implementation and the rollout side, and then they're getting the resources that they need to order to execute, and they're getting the experience of an enterprise, of someone who's been able to execute at an enterprise level. I mean, they're really getting the best of all three worlds, and you're delivering that and combining that into a solution. I mean, I think that's what really makes you different. Is that fair?
Absolutely. So we're bringing to the table over 50 years of physician, chief medical officer level attention to some of these very specific niche problems that we're talking about. We've got folks who've worked in hundreds of healthcare systems all across the country. And what's unique about us as a group is we've come together all under the same understanding of what we each believe we can do to address these problems. So as a team, we're really going to make some good things happen.
I mean, if you're in the healthcare continuum right now, you are facing a lot of dragons. I mean, having a team like the SmartIT solution that you've been able to put together of smart people to fix those problems. I mean, we're in all around it from a technology side in the clients that we have. And I've never seen a bigger mess, for lack of better terms. And I think just the way you guys are going at it makes it a great solution for these providers. Andre Hurt, you've been Zip.